everybody, I just wanted to give an overview of the maxillary mandibular anterior teeth. Some of you, as you took the maxillary anterior teeth, you may be having some heart palpitations still over that quiz, or maybe even wiping the tears away from your face. So the purpose of this little video is to help you have a better understanding of identifying the different parts of anterior teeth and identifying which one is which is maxillary mandibular, which ones are centrals, and which ones are laterals. So first we'll start off with the maxillary central incisor. So there are 8 prominent incisors in the mouth. There are 2 central and 2 laterals in each arch. I'm sorry about that. The most prominent teeth in the mouth are the maxillary central incisors. So here in yellow we have the anterior teeth, we have laterals and centrals for the maxillary teeth, and then down below are the centrals and laterals. The most prominent teeth, like it says, are the maxillary incisors, and those are the ones that we see when we smile. Alright, central incisors. The evidence of calcification starts at 3 months of age. An eruption starts at 7 to 8 years old. Again, that's going to be plus or minus 6 months of age, depending on the child's developmental process. And root completion is done at 10 years. The maxillary central incisor is the widest of all of the anterior teeth, mesial to distally. So what they're talking about is the space of the crown from the mesial portion to the distal portion, so this whole width right here. The crown has a straight incisal edge, and then to be able to tell the difference between the mesial and distal, the mesial portion of this tooth is going to have like a right angle. It's going to be really square, versus the distal portion is going to be nice and rounded. So here we can tell that this is the mesial, because we have this right angle or this square shape or more pointed shape, and here we have the distal, which is going to be more rounded. And these are going to be key points to remember for the distal and mesial on all anterior teeth. So here we have the developmental grooves, or the developmental lobes on the tooth. Each tooth is going to have, or anterior teeth is going to have 3 developmental lobes. And those lobes are going to grow and then turn into the one tooth that we see. So here on this picture we have, it's showing us where the cervical is. So here's our cervical line, our cervical margin of the tooth. Here we have our mesial portion of the tooth. Here we have our distal portion of the tooth. And here we have our incisal edge right through here. So if we remember back on the last slide, our mesial side of the tooth is going to be the more pointed or angled side. So here it's more pointed, and here it's more rounded. So that's going to tell me that this is the mesial side of the tooth. So this is going to be showing me the mesial portion, or the mesial lobe of this tooth. Next we have the central lobe. So the middle of the tooth is the central lobe. And then we have the distal lobe here, which I can tell by the rounded portion of this tooth. We also have developmental grooves, and those developmental grooves are going to be named for where they're located at. So this one is the distal labial, because it's on the distal portion of the tooth, and it's on the labial portion of the tooth, so distal labial. Here we have the mesial labial groove, and it's named mesial labial because it's on the mesial portion of the tooth and on the labial portion of the tooth. Alright, so this is a facial view of our maxillary central incisor. This is actually our right one, number 8. And this slide is basically talking about the distal portion being more rounded, the mesial portion being more pointed. Here we kind of see our developmental groove lines, but we no longer can see the actual lobes, which those would be, when we're looking at a newly erupted tooth, would be mamelons. Sorry, I can't get the words out. And we'll talk about those later. The other thing that this slide wants you to know is that the cervical line, or crest, is slightly distal to the center of the tooth. So if we were to draw a line straight down the root of this tooth, we can look here at our cervical line. The crest of the cervical line is slightly distal, not in the middle of the tooth. So that's going to give us another indication on these maxillary anterior incisors, where our distal and mesial parts of the tooth are, which will tell us which one is the left and which one is the right. The root has a cone shape, and it has a blunted apex. It's not very pointed, and is usually 2 to 3 millimeters longer than the crown. And so if we took the tooth here and we moved it up, here we have about 2 to 3 millimeters of the rest of the tooth. So it's important to understand the actual length of the tooth and how you can identify the length of the tooth by looking at it when you take radiographs. That is going to be your key indicator to tell you if you have foreshortening or elongation. So here we have the incisal aspect of our maxillary central incisor. This is actually our right maxillary central incisor. Here it's showing us the labial portion of the tooth. Here it's showing us the mesial. Here it's showing us the lingual. And here it's showing us the distal. This dotted line that's going right around here is showing us the incisal edge. So when we're looking at this incisal aspect, you can kind of see that the tooth kind of looks like it's smushed towards the mesial. So that's another indicator when you're looking at the incisal view of a tooth by telling if it kind of is mushed or kind of more pointing towards that mesial side. Because if you take a dental arch and you're looking at it, you know, that dental arch is going to be round. So our teeth are not going to be straight across. They're going to have a slight roundness to them, and that's going to help show you which is mesial, which is distal, so that you can identify which one is the left and which one is the right. Here is the lingual aspect of our maxillary central incisors. You can see there's a lot of different variations that can happen. But really what you're looking for to be able to tell the lingual from the facial is that you have a lingual fossa, which here is all of our fossa on these teeth. But you can tell that there's some variations right through here. We have some 3 triangles here, we have 2 triangles and a circle here, we have 1 triangle, we have a big circle, we have a deeper groove here. And we'll talk about more about these details when we move on further into the chapter. Here's our maxillary right central incisor, and this is showing us all the views of the tooth. So here's our distal, here's our mesial. You can see the developmental lobes, or what they would have been. You can see the barely the developmental grooves. You can see that our cervical margin is more distally than it is in the middle of the tooth. Here we have our lingual portion because we can see our lingual fossa. Here's our incisal edge. And again, if we're looking at it, we can kind of see that that tooth is a little bit squished towards the mesial. Here's our distal tooth. So if I took this tooth and rotated it this way, and here's our mesial, I could take it and rotate it this way. Next, we have the maxillary left central incisor. So we're just moving over the tooth number 9. And so here we can see the mesial, we can see the distal, we can see our developmental lobes and grooves. Here, when we're looking at the cervical edge, we can see that it's more distally than right in the middle of the tooth. We can also see how wide the root portion is and how it's blunted. Here's our lingual portion, and we can tell it's lingual because we have that lingual fossa that will identify all the linguals of anterior teeth. We have the incisal edge here, and again, if we're looking at it, we can kind of see that tooth is smooshed towards the mesial. And here we have our mesial, which we can rotate it and see facially. Here's our distal side of the tooth, and we can turn it and see it facially. Alright, so that is all for the maxillary central incisors. So just remember, when you're looking at the tooth, the more pointed corner is going to be the mesial, and the round is going to be towards the distal. And remember, we have that midline that tells us which one is right from left. So the next video will show you the maxillary lateral incisors.